Thanks, but no thanks. That's the message from Governor Malloy to President Obama.
Yeah, the Malloy administration says Connecticut's insurance companies will not extend policies canceled under Obamacare because they don't meet minimum standards under that new law. Our chief political correspondent Mark Davis is here now with more. Mark?
Hey, Darren and Sonia. Good evening, everyone, from the Hartford newsroom. Yeah, no extensions, but there is a way to get coverage. And the state says that their number earlier this week of 27,000 canceled policies was wrong. Governor Malloy opened the annual auto show at the Connecticut Convention Center today and afterward announced that state insurance companies will not extend or renew medical coverage policies that have been canceled under Obamacare, as was suggested by the president last week.
The truth is that the solution offered a week ago by the president doesn't work in Connecticut.
He says that companies like Anthem Blue Cross Blue Shield told the Malloy administration that it was too late in the underwriting year for such an undertaking.
It would disrupt the industry, but more importantly, the insurance industry made it clear that they weren't going to do that, and in point of fact, that they've addressed this problem.
Over at the state capitol, the state insurance department was telling state lawmakers that the number of people affected was even lower than they had originally said.
16,000 policies in the state of Connecticut were not offered renewal of current policies, and those are the ones that we would have been thinking about in terms of this option, which, as you now know, we have decided not to take up.
As he first suggested in a News 8 report on Wednesday, the administration is pushing those residents toward using the state's Access Health CT exchange to find substitute coverage and has extended the deadline to December 22nd for policies starting on January 1st. And that Access Health CT call-in center personnel will help the insurance companies to accomplish this.
Access Health will embed staff directly into private carriers to better coordinate the efforts to get people signed up.
And the head of Access Health told lawmakers this afternoon that some people that had already done so had found insurance coverage for less than they had been paying.
A woman that called me Monday who was paying $916 for a policy, she enrolled on the exchange. She was able to reduce that cost to $336.
Now, New York and Massachusetts and Vermont and several other states have made the same decision. Live from the Hartford newsroom, Mark Davis, News 8.